All right. Well, hello everyone and happy Friday. I am here to answer your questions related to thyroid health. So whether you have hyperthyroidism, Hashimoto's, now's the time to ask questions, or actually in about 2 or 3 minutes I'm going to just share, well, I'm already sharing my screen, my slides. Just for those who are not familiar with me, just wanted to let you know about the resources I have included in my podcast called Save My Thyroid. You could check it out at savemythyroid.com. A little bit more focus on hyperthyroidism, as it says here, just because most of the podcasts, I mean, honestly, most everything focuses more on hypothyroidism and Hashimoto's. So the most of the episodes will benefit those with either hyperthyroidism or Hashimoto's, as it says here, especially the interviews. What I've been doing more recently, I have what I call Say My Thyroid health audits, where I have someone with either hyperthyroidism or actually had someone with Hashimoto's not too long ago. So I kind of try to rotate, even though I've gotten a greater demand for people with hyperthyroidism than Hashimoto's, but either way, most, I'd say, like probably 80-85% will benefit those with both hyper and Hashi's, hyper and hypo, and those the remaining like 10-15% might, maybe even less than that. But again, there's definitely a little bit more emphasis on hyperthyroidism. All right, naturalendocrinesolutions.com. So savemythyroid.com is a little over 3 years old. So my podcast came out in August of 2021 called Save My Thyroid. I'm like, you know what? Save My Thyroid's a lot easier to remember than naturalendocrinesolutions.com. But naturalendocrinesolutions.com has been around for 2010. So close to 15 years. This website's been up. Has hundreds of articles and blog posts. So if you prefer reading, visit naturalendocrinesolutions.com. If you want to listen, go to savemythyroid.com, or just go to your favorite podcast platform, type in Save My Thyroid. YouTube also have I don't think I have it on the resources page, but you could also check out. Some of you are already tuning in from YouTube. And my supplement lines, I do have a supplement line, thyrosave.com. And then books. So I got 3 thyroid related books. My first book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, was released in 2011. Just last year around this time, I released the 3rd edition. So yeah, definitely check that out. Hashimoto's Triggers was released in 2018. Quite a comprehensive book, over 500 pages. And then in 2024, so this year, spring of 2024, released my 3rd book, The Hyperthyroid Healing Diet. And you could, of course, find all those on Amazon, as well as where other books are sold, or other places where books are sold, like Barnes and Noble. All right, so now let's get to the questions. And for those who trick on late, I guess I'll just leave this up. um, But let's see. So our first question is from the Off Grid Experience Montana. So I have a question. I just had my antibodies testing done. All of my antibodies for Graves and Hashimoto's are within normal range. Does this mean I have these autoimmune issues, or is something else going on? Do you mean that is, maybe your question is, does this mean that you don't have these autoimmune issues since they're negative, since they're within normal range, like they're I mean, or are you asking because they're normal but they're still detectable that you have autoimmunity? I mean, either way. So I should also mention that I just released this past Tuesday the first episode in a series of podcast episodes on thyroid antibodies. And so thyroid antibodies, first of all, most of the time when someone has Graves or Hashimoto's, they're present, but the absence of thyroid antibodies doesn't always rule out autoimmunity. and they shouldn't necessarily be zero. Like that, like just because you have them, and let's say, I mean, the reference ranges are different. So, like for some of them, like some labs for thyroglobulin antibodies, which are more closely associated with Hashimoto's, their range is less than one. So essentially, if it's great, if it's one or greater, or yeah, it might be less than. Anyway, so pretty much any detectable thyroglobulin antibodies, according to some labs, would mean that you have autoimmunity. Thyroid peroxidase antibodies depends on the lab. So does the thyroglobulin, also could depend on the lab, but TPO antibodies. Let's say you have a lab where sometimes the range will be less than 9, sometimes it'll be like between 0 and 34. But let's say if someone has TPO antibodies of 7, I mean, I wouldn't really be concerned about that. Similar with Graves, if someone has thyroid stimulating immunoglobulins that are well within the reference range, but they're there, again, I wouldn't really be too concerned. But yeah, so just if you have, if they're not completely zero, like if they're not less than whatever, um, according to the reference range, yeah, I wouldn't say it's something I would necessarily worry about. Um, yeah, I mean, that being said, really always should be doing things to optimize your immune system, even if you don't have autoimmunity. I mean, just yeah, just with yeah, I mean, obviously the other immune conditions like cancer and just and pretty much any inflammatory condition involves the immune system. So yeah, but hopefully that answers your question. And any other questions? So far, that's the only question that we have. So if there are other questions, now is the time to ask. And I got the for those who trickle in late. These are just like some of the resources that are available, and then also my books too that are related to thyroid health. And hard to believe that it's already mid-November. So in not October, going backwards. So in probably January, I'll have my next live event. So for those who are also new, I usually have multiple live events, like whether it's challenges or boot camps. Not exactly sure what I'll be offering in January. So this past year, I offered, trying to think, I think I had in January of this year, 2024, accelerated thyroid healing diet. And then when I released my book, The Hyperthyroid Healing Diet, I had a Hyperthyroid Healing Diet Challenge in March. And then I had a, a boot camp, a thyroid related boot camp in June. And then August, Foundations of Overcoming, I think it was Graves' disease and Hashimoto's uh, challenge, I guess it was, or just live events. I have different names for them. But and then I had a thyroid summit, which wasn't a live event, but Save My Thyroid Summit, which was pre-recorded, but it was released. It was yeah, it was launched in late October. So so again, this month and in all likelihood December, I won't be doing any events, but January, and then we'll probably see also in March. So we'll see. I need to really come up with a schedule for next year, which I haven't done. Been trying to keep up with everything, including the podcast. So um, let's see. So biweekly, how can your labs go from normal to out of range within a year? A lot can happen. A lot can happen in a year. A lot can happen in 6 months. So I mean, diet and lifestyle factors, including stress. It could be some type of infection. It could be, I mean, we all have increased toxic burden, but it just reached a point where it led to your labs getting out of range. I mean, yeah, it's a simple question, but it's complex because, I mean, and normal doesn't always mean optimal. So maybe your labs were normal a year ago. Maybe they weren't. I mean, maybe they were normal, but were not optimal. Maybe they were optimal. I'm not sure because I haven't seen them. But yeah. So hey Paola, how you doing? Yeah, good to see you. Hope you are doing well. And thanks for tuning in. If you have any questions, definitely let me know. All right, nice to see some familiar faces. Okay, just Jules. So we have a number of people on from YouTube. I think we do have some Facebook comments coming up next. But do you have any in-depth podcast for newly diagnosed hyperthyroidism? See endocrinologist mid-December. I don't see many videos about more natural options. I do actually. There is an episode on newly diagnosed hyperthyroidism. Not sure what it's. I also have a episode on my website, not an episode, an article on my website, naturalendocrinesolutions.com. So let me just quickly see if I visit Save My Thyroid. And then because there is a search. Okay. And Karen, you just ask the questions just in the comments. So you just type in the comments, the questions. And then, yeah, I'll try to get to as many as I can. Uh, let's see. So let's see what happens when I type in newly, the word newly. Um, it might be recently. Oh, yeah. Oh, yeah. So there is an article, 10 tips for those recently diagnosed with hyperthyroidism, which actually there's an article on that, but I turned it into a blog post episode. So yeah, if you just visit savemythyroid.com, type in 10 tips or type in recently and you should see that. But yeah. And then also my book too. My book, Natural Treatment Solutions for Hyperthyroidism Graves' Disease. I would say even if you're newly diagnosed, you could benefit from that. I mean, there are more basic books as well, but um, let's see. So we got Diane. So do I need to take vitamins if I got tested and there is nothing I need to supplement? Is there any vitamin which needs to be excess due to the diagnosis? How often should I do the blood work? I mean, I do recommend some basics. I mean, yeah, I do recommend supplements based on the testing, but if like everything comes back normal, I mean, obviously we might need to do additional testing, but I do recommend like basics like an omega-3 fatty acid. And I mean, if someone does a fatty acid profile and it looks amazing, maybe they don't need it, but a lot of people won't test for it. So if you're not testing for it, and most people aren't eating fish 3 days a week, for example, or seafood 3 days a week. So omega-3 fatty acid, I commonly recommend a probiotic. Uh, Vitamin D, a lot of people need. I take vitamin D or else my D levels drop. So, I mean, those are a few examples. I mean, I try not to, especially when I see someone for the first time, my goal isn't just to give them a list of supplements. I do, again, try to give a few basics, try to do testing. Again, vitamin D is one of those I would test, and a lot of people are low. So it does depend on the findings. And then as far as how often should you do the blood test, I mean, as far as like thyroid panel, I would say ideally every 2 months, no longer than every 3 months, which is kind of on the longer side. Some people do it every month, which is fine. So if you do it every 4 to 6 weeks, that's great. 6 to 8 weeks, I think, is pretty good though as well. All right, so Paola, FYI, my last two thyroid labs are totally normal 3 months in a row. I pretty much healed it already. It took about 10 months, so almost like you. All well and all the natural approach. That is awesome. Well, thank you for sharing, and yeah, you are welcome. That is great. So thank you. Thanks for sharing, Paola. Great to hear from you. And also put no nasty pharmaceuticals, only LDN, no radiation, didn't let them touch my thyroid, and I am completely healed from hyperthyroidism. I was also able to stop all tinctures on selenium and NAC still. Awesome. Cool. Yeah, that's one thing. For those, a lot of people ask, like, am I still on bugleweed and motherwort? Because I did take those years ago, and I took those for a while, but I haven't been on them since 2009, so 15 years. Sounds like it sounds like the same with you, that you're off of those. So wonderful. um okay, let's see. So Just Jules says just got the uptake test done and no hot or cold nodules. Wonderful. That is good news. Really good news. And okay, you are welcome. All right, hold on just a sec. My daughter just texted me, which I wouldn't have known. I took it off airplane mode to search for that question, but usually I have to pick her up today, so that's I can't stay on like too long. But let me make sure everything's okay. So I'm just texting her on the side, which I usually don't do but again, she usually doesn't. She actually tried calling me, which she usually doesn't do. So okay, all right, Karen, I'll get you in just a sec. All right, so Karen, what does the transition from methimazole to bugleweed or other natural hyperthyroid support look like? What time frame? Been on 10 milligrams twice daily, methimazole 5 days, and seeing gradual decrease in symptoms. I mean, pretty much the approach. Okay, good. Nothing's wrong with my daughter, so just had a question. So, all right, no emergencies. That's good. uh, the approach I do. So I can't tell someone to stop taking the medication. So if someone's taking methimazole and they're trying to make the transition to bugleweed, I pretty much would I would tell the person I'm working with to take bugleweed along with the methimazole, like maybe like 30, 45 minutes apart. And the dose depends. I actually have a episode on the podcast recently, like, and the title is it's a Q&A episode. How much I think it's how much bugleweed should I take? So definitely check that out. But anyway, I would have them take that, and then the goal is to hopefully it pushes them more towards the hypo side, and then the prescribing doctor would reduce the dosage of the med. So, like for example, you're taking 20 milligrams total, 10 milligrams twice a day. And so if you're more hypo, it really depends. Some endocrinologists, I mean, unless you're like super hypo, they're usually not going to drop you down dramatically. They might drop you down to 15 milligrams, or they might have you take 5 milligrams twice a day. And then you would do the next blood test. So, I mean, it's definitely a slow process. Like it's not like 2 weeks you would be off the methimazole, but also part of it depends on how much methimazole someone's taking. If someone's only taking 5 milligrams of methimazole, then again, they might get off of that. And good chance they will get off of it sooner than later, again, under the guidance of the prescribing doctor. But 20 milligrams, it's kind of like I wouldn't say a super high dose. I've had patients on 40 milligrams, but it's not a low dose, so it's a medium dose. So it wouldn't be a surprise at all if it took a few months to get to that point, assuming it works. I will say bugleweed is effective in most people, but some people they just don't respond to it. And again, just the potency is important, how much you're taking. So definitely check out that recent podcast episode that I released. So let's see. Okay, so Diane asks, how do I know if I have leaky gut or if I have no symptoms? How do I know if I have leaky gut if I have no symptoms? I'm sorry. So, yeah, leaky gut doesn't always result in symptoms. So I used to do a lot of testing for leaky gut, and there are different companies that offer this. You could test zonulin through the stool, which isn't completely reliable. So if it's elevated, then you most likely have a leaky gut. If it's negative, it doesn't rule out a leaky gut. I used to use, there's a company, Cyrex Labs, Cyrex, Cyrex Labs. They have a test, the intestinal antigenic permeability screen, also known as their array number 2. And so that's what I used to use. And a lot of people, most people tested positive, and not crazy expensive, but it's still about $200. And I was just thinking, like, do I really need to have everybody pay to test for a leaky gut when we know they probably have a leaky gut and it's not telling us why they have a leaky gut? And even if someone tested negative, I'd question, is it real? Are they really negative? Because at least according to the triad of autoimmunity, people with autoimmune conditions, like one of the components is a leaky gut. So the approach I take now is I just assume that people have a leaky gut and just do things to help support the gut. And that's my approach. Everyone's different. Every practitioner is different. A lot of practitioners do do take a similar approach where they assume that someone has a leaky gut. Others will test. But like I said, the testing's not perfect, especially zonulin, which is on some comprehensive stool panels. So even the classic lactulose mannitol test, also not perfect. But yeah, so hopefully that answers your question. So Piola says, I did the thyroid panel every 8 to 10 weeks for a year and a half, and now going every 4 months. Yeah. So, yeah, once in remission, like I'll do it now, like once a year, sometimes twice a year. But yeah, once you're in a good state of health, no need to test it regularly. If someone wants it, I mean, 4 months, it's been relatively recent for you. So you could keep that pattern if you want, but eventually I'm sure you could go to like 6 months and even further. And thanks to all your help and information. You are welcome. Thank you again for sharing. And then biweekly, my thyroid labs went out of whack. Hyperthyroidism grays very suddenly and was severe very quickly. Okay, so yeah, thanks. Thank you for sharing. So let's see. Biweekly asks, what's the difference between hyperthyroidism and Graves' disease? So Graves' disease hyperthyroidism is when you have elevated thyroid hormone levels, elevated T3, T4, and TSH, thyroid stimulating hormone, which is a pituitary hormone, is depressed because you want like TSH signals to the thyroid gland to produce more thyroid hormone. But in the case of hyperthyroidism, you don't want that signal. You don't want more thyroid hormone. You want less. So that's why you see less TSH, and you're going to see the elevation in thyroid hormone, unless if someone has subclinical hyperthyroidism, which I won't get into here. But if it's overt hyperthyroidism, you have elevated T4, T3, low TSH. And so with Graves, you have hyperthyroidism, which I just described, but it's autoimmune. So you have the immune system attacking the TSH receptors of the thyroid, which leads to the excess production of thyroid hormone. And thus, it's the autoimmune response that's causing the hyperthyroidism. There are other conditions like subacute thyroiditis, which is not autoimmune, but that involves typically a virus that damages the thyroid gland, and you get release of thyroid hormone into the bloodstream, resulting in hyperthyroidism. There's toxic multinodular goiter, where someone has an enlargement of the thyroid gland along with multiple nodules, along with hyperthyroidism as well. Okay, and you're taking 2.5 milligrams of methimazole, so hopefully that makes sense. And Karen, you are very welcome. Okay, stay in your lane, Doctor. Hey, Dr. E, how are you? You are. I'm doing good. Hope you are doing well as well. Just took the quiz. So cool. Okay, yeah. So yeah, if you want to take the quiz, anybody visit savemythyroid.com. Just visit my website and you'll see it. The homepage, the quiz. I think also if you do savemythyroid.com/quiz, but just if you visit Save My Thyroid. But it's actually been out. The quiz has been available for a number of years. But yeah, so some people, they don't know because they don't visit the homepage of the website. But I think now on my podcast, I mention it at the beginning of my podcast, just at least temporarily. It's not always going to be like that. But yeah, cool. Glad you enjoyed the Save My Thyroid quiz. So Jessica says, I have had Graves' hyperthyroidism for about 3 years now. That's been fluctuating after 2 pregnancies. Do you think if I start the natural treatment, it'll get better? I mean, yeah, just because you've had it for 3 years doesn't mean that you can't restore your health. I mean, there are people with Graves, Hashimoto's, who have had it for their condition for a longer, much longer time. Now, Hashimoto's a little bit different because you get damage to the thyroid gland. But when it comes to the autoimmune component of Graves and Hashimoto's, it really doesn't matter how long you've had that for. It really comes down to finding, removing triggers. So I definitely would start out doing as much as you can from a diet and lifestyle standpoint. Again, plenty of information on the podcast. But if you want to go deeper, you might want to look at the books actually that are on behind me are on the slide next to me. The three, 2 to 3 books in the case of Graves' disease, but the first one, Natural Treatment Solutions for Hyperthyroidism, Graves' disease, and then the Hyperthyroid Healing Diet. But yeah, definitely still hope. So would yeah, would look to do things to improve your health. So payola, I took 4 droppers a day of herb farm thyroid calming. Also took motherwort and lemon balm, 1 dropper full daily. Wonderful. Okay, so stay in your lane says I took an ultrasound, found 2 small nodules. How can I get busy healing those? Also, TPO finally dropping. Oh, wonderful. I'm heading into remission. I feel it. Amen. Thank God for you and what you do. That's great about the TPO antibodies. I mean, nodules, I don't want to say don't worry about them. A lot of people do have nodules. I do have some episodes on the podcast and on my website talking about nodules, problems with estrogen metabolism as well as insulin resistance are 2 common causes of nodules. So yeah, those are things that you might want to look into. Uh, Insulin resistance, you can do blood testing, hemoglobin A1C, fasting insulin. With estrogen metabolism, the only test I know of is dried urine testing, and the main company that people are familiar with, including myself, is called the Dutch test to look at the metabolism of estrogen. Inflammation, overall inflammation could also be a factor. So those are definitely things you want to address. All right. So Karen, how long does it take for TSI graves to decrease? I mean, it could decrease relatively quickly, like within a few months. I mean, not all the time. Sometimes it could be challenging and take longer, but it takes a while to normalize. I mean, in some cases, it could take like a year or longer to normalize. But as far as like seeing it consistently decrease, it can in some cases happen quickly. So Cam, while on so dealing with hyperthyroidism graves, what's the best way to treat if you've had it underlying for a long time? I mean, again, these simple question, but not a simple answer. I mean, the simple answer is you change your diet and lifestyle and find and remove the triggers. Now, how do you do that? Again, I could give like an hour or 2 presentation, but that's why I have the podcast. That's why I release episodes on the podcast to talk about that. And so definitely you could do a search on my podcast. If you want more organization, check out my books, Natural Treatment Solutions for Hyperthyroidism and Graves' disease, 3rd edition, as well as the Hyperthyroid Healing Diet. But again, finding, removing triggers, healing the gut, uh, and yeah, definitely starting out with changes in diet and lifestyle. Um, and then also, how long do you recommend being on carbimazole? I mean, everybody's different. Well, so carbimazole, for those who are not familiar, it's a type of antithyroid medication that converts into methimazole, but typically recommended not in the United States, but some other countries like UK, for example, is one area where carbimazole is recommended. So, I mean, it depends on the person. I mean, endocrinologists will recommend it typically 18 to 24 months. And I'm not saying there's like people never need to be on it that long, but the problem is most people who are on it that long aren't doing anything to address the cause of the problem. So, so again, the preference would be the least amount of time possible. But and then obviously not everybody needs to be on it. Like I took bugle weed, and motherwort. I did not take the anti-thyroid medication. But again, everybody's different. There definitely is a time and place for it. All right. Let's see. And Anna, just let you know, I didn't. I hope you're doing well, Anna. I didn't see your question. You said, "Can I check if I missed the answer to my question?" Did you type your question here, or was it in the Facebook actual Facebook group? Because if it's in the Facebook group, I typically don't look unless if I don't get any questions live. Then then I look and see. But we're getting flooded with questions here. So if you typed it, yeah, I would copy and paste it and put it here, and I'll definitely respond. But yeah. So let me get back to Sasa here, who says how to cure a goiter naturally or make it smaller. So similar to nodules, I mean, inflammation could be a big factor. I mean, first of all, you want to address the hyperthyroidism or hypothyroidism. Either too much thyroid hormone or too little thyroid hormone could result in a goiter, which is essentially a swelling of the thyroid gland. So you want to address that. Overall inflammation could play a role as well. I mean, not overall inflammation, which affects can affect thyroid too. And then with thyroid nodules, I mentioned insulin resistance, problems with estrogen metabolism. Those could also be a factor with a goiter too. So those are some of the things I look into, and I do have podcast episodes as well as articles. So again, check out. Let me switch to the other slide. So here are the resources: my podcast, my main website, naturalendocrinesolutions.com. You could visit either one of those, do a search for goiter, and you'll find should find articles and podcasts. So if you like to read, visit naturalendocrinesolutions.com. If you like to listen, visit savemythyroid.com. And you're on YouTube, you might even be able to type under my YouTube channel, Natural Thyroid Doctor, type goiter, and there very well might be a video, because my podcast now automatically uploads to the YouTube channel. All right, so stay in my lane. Listed, yeah. No, yeah, savemythyroid.com/quiz. Okay. um, all right, let me just make sure I'm not missing anybody. Okay, so yeah, it's in the Facebook group. Yeah, go ahead, and if you copy and paste it here, again, I'd be happy to answer it. Just try to do it quickly, because I'm not gonna stay on too much. I've been on for a little over a half hour. I gotta soon pick up my daughter, who called before while I was on the doing this Facebook Live, who I need to pick up soon. So, but let's see. I could definitely stay on for a little bit longer. So Diane, is hormone balance yoga is okay. I'm not sure what this. I'm not sure is hormone balance yoga good also for hyperthyroidism, or just for hypo, for boosting hormone? I'm not sure what hormone balance yoga is. I mean, I'm familiar with yoga, but not hormone balance yoga. So I don't know. I mean, I know yoga is okay for both hyper and hypo, but can't say I'm familiar with hormonal balance yoga. So Paola says, Cam, buy Dr. Osansky's book and learn everything he teaches. And you can very likely heal like I did. All right. Thanks, Paola. I promise I didn't pay pay off Paola. She's sounds like just excited to receive the great results. So I appreciate you coming on. And then also she says, stay in your lane. Congrats on your healing success. My TPO went from 615 to 92. TSI from 140 to 82, doing way better. LDN and NAC really helps with that. Awesome, awesome. And then I'm on the way to the website after the live. Karen, how do you treat estrogen metabolism? Well, I mean, you want to definitely reduce your exposure to xenoestrogens, like the plastics. If someone's drinking out of plastic water bottles, or just has a lot of other exposure to plastics, then you want to try to stop that. But Uh, Cruciferous vegetables, broccoli, really good. Broccoli sprouts, even better. Uh, Sometimes I recommend diindolylmethane or DIM, but it depends. If someone has low estrogen levels, even if they have a high metabolism, like high 4 hydroxy or high 16 hydroxy metabolites on a Dutch test, um, I wouldn't want to give DIM. In the past, I gave DIM like years ago because I didn't know any better, but then learned that could lower estrogen levels too. And if they're already low, you want to be cautious. So if estrogen is low, but the metabolites are high, then I usually recommend a sulforaphane supplement. And then stanulin, I just remembered, is there a new version of the optimal levels for labs available? I'm retesting soon. No, no new no new version that I have. Let's put it that way. Okay. Thank you very much. We'll buy your book and listen to the podcast. Wonderful, wonderful. Thank you so much. And bi-weekly. Thank you, sir. And then what's your Facebook group called? Yeah, I should put it on the resources because again, now like in the past, I used to just broad live stream into the Facebook group, but then didn't allow that in the group. So now I do it to my Facebook page and YouTube. But if someone's on YouTube, they might want to know about my Facebook group and vice versa. Then on the Facebook page, I might want to know about the YouTube channel. But um, let's see, is it Graves? Should know I have two of them actually. So let's see. Again, I should know this, but there's some that are so similar to mine that okay. So great hyperthyroidism and Graves' disease natural solution support group, and then if someone has Hashimoto's, there's also Graves' disease and Hashimoto's natural solution support group. So yeah, I could put it also in the comments. So I'll put the Graves' disease and Hashimoto's natural solutions support. Okay, so I put that in there, and okay, so Anna, so thanks. I don't know if this is the same Anna who's in the Facebook group, but now is on YouTube and copied and pasted the question to YouTube. But anyway, so I have a feeling you did an interview with someone regarding Graves and perimenopause. Is that correct? If so, do you remember who that was? Let's see. I've had, I think, a few with perimenopause, few interviews. Let me see what let's see. Just again, I would just go. I'm gonna go to my podcast and just or savemythyroid.com, type in perimenopause. Um, so I have a few weight loss struggles in perimenopause and menopause with Louise Digby, who is a nutritionist. And then perimenopause and thyroid health with Dr. Jennifer Rollins, which the audio quality, unfortunately, wasn't great for that. Those are the main two that focused. There was another one, Dr. Christy Tompkins. But again, what I would do is just visit savemythyroid.com and then type in perimenopause and you'll find those episodes. Or again, you could visit naturalendocrinesolutions.com if you want to find articles, blog posts, or transcripts to the podcast. All right. So Dan says, are you still strictly skipping all the no good food? If not, how often and what? Again, I can't possibly like say like again like go. I mean, I meaning well, I'll say this. I mean, because again, I'm not definitely not perfect. So I'm not following like AIP. I'm like modified paleo. So I guess my point is I can't like go through like all the food categories and say this is exactly what I mean, I could, but I don't have time. So I mean, like, for example, I'm, modified paleo, but like sometimes I'll eat grains, like maybe like rice or quinoa a few times a month. And again, part of it is just I don't can't say I love grains, and so I'm not just having it a few times a month because I'm worried about having it like a few times a week. While healing, I usually recommend. I mean, I pretty much always recommend avoiding grains, but even like pizza, it varies. Like sometimes I'll have, and typically it is gluten free, like a cauliflower crust pizza, but not a dairy free pizza, and I'll have that. I mean, again, maybe once or twice a month, but sometimes I'll go a few months without having pizza. So it varies. And again, there are other things. I mean, but like I said, I can't really like g- go down like all the different foods because like I said, I definitely stray from the diet, but it's yeah, I try most of the time to eat paleo, but probably like 80, 85% of the time. So that leaves like 15, 20%. So definitely room to indulge when one is in a healthier state. um, all right. So payola, yep, he didn't pay me. Okay. No, I didn't pay her to and stay same thing with stay in a lane, stay in your lane. Any newbies here, definitely go to Dr. E's website. He's amazing. Thank you. So yeah, I did not didn't know that either one were or showing up to this, but I appreciate it. So thanks for the compliment, whoever said. Thanks. So you can't see the. All right, let's. Yeah, this is the Graves' disease and Hashimoto's natural solution support group. Oh, it's weird how when I type it in the comment, it shows it from coming from Graves' disease and hyperthyroidism, like that page, huh? That's weird. Oh, okay. Okay. And I just want to make sure. I figured it was you, but you were in the Facebook group, and then all of a sudden, I got a message from on YouTube. So I just want to double check, or maybe the what I'm not sure what's okay. Anyway, this is so this is not the yeah, this is my YouTube channel, Natural Thyroid Doctor. So oh, maybe what happens when I see what happens when I type in the comments because I'm streaming to or three different places. So this is one of my Facebook pages. This is my main one, natural treatments or natural solutions for Graves' disease and Hashimoto's, and my so that's weird. I didn't know that happens when I type in something. It shows it from all three sources. Okay, listen to that one. Anna, you are very welcome. Okay, and yeah, there's website, which is also on the slides. And okay, stay in your lane also says so that she wasn't paid. So um okay, so Paola eat proper human diet, 100% was able to keep the dairy throughout and heal fine. No liquid milk. I never touch grain, sugar, starches, tubers, legumes, nightshades, or high oxalate plants. So she's doing a better job than me on a wellness basis because I can't say that I never eat any of these, on a wellness basis. Again, while healing, I think it's different. And even once someone heals, maybe for a little bit it's I think it's a good idea to like still be pretty good with the diet, but yeah, again, so I like I said, I definitely I meant like high oxalate plants like spinach, like for example, that you yeah, I used to eat a lot of those, but it's not like I don't eat any things that are high, not super crazy high, but yeah, so like I said, payola is currently doing a better job than I am. But which is to me, I say this also to be encouraging because I don't want people to think that they need to follow the diet like 100% forever. Like, does everybody need to avoid nightshades like payola currently is for good? No, I mean, some people like again, I could eat. I'm not a big tomato person, but again, I've had exposure to tomatoes, and again, I'm not an eggplant person. But the point is, everybody's different. So, um, the very last one. So, can you please share some ideas for breakfast as we have to skip grains? nuts, gluten, sugar, dairy, and getting constantly hungry and losing weight. I mean, pretty much if you're not eating eggs, like if someone's following autoimmune protocol, then I would say either have like a smoothie and add some protein powder like hydrolyzed beef or um, like bone broth protein, which is their AIP compliance, or dinner leftovers for breakfast. Essentially, is what a lot of people do. So they'll make enough for dinner where they have leftovers and eat that for breakfast. I mean, those are like the two biggest ideas I could give when it comes to breakfast. Again, a smoothie, protein rich smoothie, or leftovers. So fastest way to gain weight, address the cause of the problem. Like what like if someone is like I lost 42 pounds when I dealt with hyperthyroidism, and eating more wasn't the solution. It was addressing the lowering the thyroid hormone levels. If someone has gut issues, then you want to heal the gut. You want to figure out why they have the gut issues. Is it gluten? Is it parasites? And then address whatever is causing the gut issue and heal the gut. So there's no like one fastest way to gain weight, but you want to address the cause of the problem. And even then, it could take a while. Yeah, like I lost a lot of weight. I can't say I gained most of it back within a couple of months. It took. I mean, now I did. I mean, now it's like again, now it's the opposite problem where I got to be careful, or else again I'll be looking to lose weight. So, um, and it again, but yeah, it does take time. So Paola says, I can't afford to go back, not worth it. Nothing tastes as good as healthy feels. And that is true. Again, I feel pretty good with the diet I'm on, and but there are some people that are more strict than I am just because they're like, you know what? I don't need to eat these other foods. I feel great. And especially if they felt really bad at one point. So definitely understand. Um, cool. I'm almost like payola and staying until I'm totally healed. Then I'll sneak back over. uh, Awesome, awesome. Thank you for this information on hyperthyroidism. You are very welcome. Thanks for tuning in. Thanks, Karen. All right, awesome, awesome. So, well, thank you, everyone. This was a great Q&A. We had a pretty good turnout. Again, I'd love to do like 2 of these per month. It's just hard. Again, I have so much to keep up with everything between working with patients, and then also the podcast and other things. I mean, I just finished the summit, and again having events on like a quarterly basis. I mean, so just and obviously like yeah, just writing books. So probably won't be releasing any books. I don't think in 22. I mean, always writing, but I don't unless if I speed things up, probably won't release anything in 2025. But you never know. You never know. I'm pretty prolific at producing content. So, but thank you. Thanks everyone. Really great to again have you tune in on this Friday afternoon. Diane, you are welcome. Again, thanks for your questions. Anna, don't get too busy. Oh, it's too late for that. I mean, it's been too busy. I mean, again, I don't want to say too busy because I like being busy, but yeah, I'm definitely never bored. Let's put it that way. So there's always things to do. I mean, I love what I do. I mean, some things obviously I love more than others. I mean, there are things I think with any position that I prefer not to do, but doing things like this and working with people, I mean, these are definitely things I love. So again, I probably won't be on next week, and then we have Thanksgiving. So for those in the United States who celebrate Thanksgiving, have a happy Thanksgiving. I will try to pop in at least once in December for one of these. But anyway, everyone, again, have a great rest of your Friday, a great weekend ahead, and hope to catch some of you soon. So all right. Well, take care, everyone. Again, have a great rest of your day, and thanks for your questions.